Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi, everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. I'm in Burrawang in New South Wales in Australia, where it is just gone 9:30 on Wednesday morning, and gives me great pleasure to welcome a good friend of mine from a few years now, Rachel Wall, who's in Charlotte in North Carolina. And we've just been having a good old chat for half an hour before switching on the recording. But Rachel, good to see you. And thanks for being a guest on the Ultimate Dental Podcast.
My pleasure. So good to catch up, David. It's been a long time.
It has. It has. We were just saying that I think I first met you in 2011 at a dental speakers conference. And that's where I used to see you every year.
Yep.
But because of COVID, basically, I haven't been to the United States in the 2020s at all. And so everything I've done has been virtual in that time. So I'm enjoying being a podcaster. It's been a year, and getting to chat with old friends and new friends about what they're doing and what they're up to and what they've seen in dentistry. So, Rachel, you're the owner and director of Inspired Hygiene. And
Yes.
I know that when I have clients or contacts in the United States that need hygiene coaching, I send them straight to you because I think your company is the gold standard that I look up to.
Thank you.
You've been around. I'm sorry to say this. You've been around for a long time, and
Yes.
so you don't look like it. You have, and so you've got the runs on the board. But I think for today's conversation, I'd like to find out about your journey as an owner of Inspired Hygiene and what you're seeing now in terms of what's going on in dental offices, in hygiene, in staffing, and in doctor, hygienist, patient relationships. So we could probably talk on this for a day, but let's see how we go.
Yeah. Okay, great. Thank you so much for that introduction. Yeah. So I'm a hygienist of over 30 years, and 21 years ago this summer, I started Inspired Hygiene, and have been so blessed and fortunate to work myself and the amazing team that I get to work with. We have worked with practices in about 45 states and in a couple provinces in Canada as well. We haven't made it to Australia quite yet, but hopefully that's in the future. But we've learned so much being able to be with these teams and just really develop a framework. We call it our Inspired Hygiene system that really helps teams elevate the services that they're providing in the hygiene department, create clear systems and calibrate their team so that everybody's on the same page with diagnosis and treatment standards. And then that just has a trickle down effect of, healthier patients, more engaged hygienists, and a more profitable hygiene department for the practice as well. So yeah, I'm looking forward to kind of sharing notes and sharing a little bit of what's happening here in the US.
Yeah, and we discussed this before starting the recording because I have always believed that what's going on in the US, especially in hygiene, is ahead of what's going on in Australia. Australia is very slow in or delayed in taking up things in the hygiene space. And I still find today, talking to dental practice owners, that they would rather employ associate dentists to do hygiene than have hygienists doing hygiene. And I know that, I put on my first hygienist in 1999 in my office, and it was a game changer for me. I had purchased my neighbour's practice next door to mine. He'd come in and worked for me for 8 months and then left. So I had too many patients of my own, plus his
Sure.
patients to look after. And so I employed a hygienist and gave all my patients to the hygienist. And then I
Mm-hmm.
cleaned his patients for a year and met them
Mm-hmm.
and then gave them to the hygienist as well. So
Mm-hmm.
therefore, hygiene just became a way of life for me, having a
Yeah.
hygienist, and there was no going back.
Yeah. Yeah. I love that. Why do you think that is, that dentists in Australia are preferring to hire uh, associates? Because we're seeing some of that just out of necessity. But I'm curious to hear some of the rationale behind that.
I think it's a difficult thing to say, but I think they're focused on the pennies and not on the
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 dollars
Franklin. They're
or
not
the
on
care.
yeah,
Mm-hmm.
they're not focused on
Mm-hmm.
on
Mm-hmm.
the care. One thing that I
Mm-hmm.
enjoyed was never having to diagnose it in a dirty mouth.
Mm,
So every time I saw a mouth that had already been cleaned and was
mm-hmm.
in a state of better health. Plus, I could see
Mm-hmm.
everything. Plus, my hygienist had also done a pre-examination,
Mm-hmm.
as well. So it was a team effort in looking after
Yes.
the patient. And I thought, there's no way I can go back to doing that,
Mm-hmm.
and doing it
Mm-hmm.
myself. But some dentists who don't even have associate dentists will say, well, I can do I can book two cleans in a row, and if there's one of them needs a restoration, I can do it at the same time. I might run late
Mm-hmm.
into the
Mm-hmm.
second one, but I'll catch that time up. And so they're
Mm-hmm.
not looking at they're really looking at doing same day dentistry. And I found
Mm-hmm.
that when I had a hygienist, I'd never did same day dentistry. It was you,
Because your schedule was full.
my schedule was full, and so we had to
Yeah.
schedule their restorative appointments. So
Yeah.
I even felt guilty if I went in and I said, look, I can do that now because I had a change. I just felt
Uh-huh.
guilty about doing that because they would think, oh, you just found that because you have got time. And I never
Uh-huh.
wanted
Ah,
to feel like that. So,
yeah.
um,
Yeah.
but I know in the US, same day dentistry does make up a big chunk of people's production in a lot of practices, and they're built for that sort of situation. People take a day off,
Yeah.
go to get their teeth cleaned, and then they want to get it
Yeah.
done
And
and done at the
typically,
same time.
I would say in practices that have a thriving hygiene department, um, same day dentistry is something that they plan for, right? So it's not only done when there's a cancellation, right, or availability on the doctor's schedule. If it is something that they really want to work towards, it's something that's planned for, and there's time allowed for that in the schedule. But it's really interesting, David, because what I'm picturing when you talk about adding associates rather than hygienists is it's not it probably is not that the senior doctor is having the associates do hygiene. It's the senior doctor still doing their own hygiene, and then they just duplicate that with the associate, right? The same model. Whereas what you were able to achieve utilizing that partnership with the hygienist and the dentist is really having that diagnostic partner and having your schedule full with high quality treatment that was already teed up by the hygienist because the two of you really collaborated and you were calibrated on treatment philosophy. So that partnership is a really beautiful thing, and it's been a very successful model when it is optimized for patient care, for communication, and the hygienists are really calibrated and doing as much as they can within their license. So there are a lot of different buzzwords that are going around right now, and there's a lot that's happening in the US. Now, I know that you have listeners all over the world, so I don't want to, you know, insult the US listeners and they're like, yeah, we already know all this, but I think there's some lessons that can be learned just talking through this and from your perspective, right, working in a slightly different model. But since 2020, there's been a huge, I'll call it a shakeup, right, in the dental hygiene industry, and some of these things needed to happen anyway. And I think there's a lot of things that needed to happen anyway that COVID just accelerated, right? The pandemic accelerated, and also it just brought it to light in a way that we couldn't ignore it anymore. One of those things was, there certainly were some staff members in dental practices that hadn't seen pay increases in a very long time, even though the practice was profitable. And so there were certainly some, I would say, resets that needed to happen with regards to that. And there were some folks that made a decision at that point in time, in dental hygiene and other roles in dentistry, that it was time to step out, of the profession as a whole. Some of those people came back after a year or so, but there were, a large number of dental hygienists that retired or left the profession, larger than normal attrition. And then at the same time, right, there were delays and things that happened. There was a dip in hygiene graduates for the first, year or so after COVID. And so we've really had a hard time making up that math, right, with the number of dental hygienists out there. And there's even a debate between different entities in the US on whether or not there even is a dental hygiene shortage, or if it's just a culture problem within dental practices, and that the practices that can't find a hygienist don't have a healthy culture. And what I know is that there's no absolutes in all of that. Is there are certainly practices that have a very healthy culture that are having a hard time hiring hygienists just because of lack of availability in their particular areas. So all of that has just created a lot of different challenges with regards to patient care, availability in schedules for patient care, staffing, and relationships between dentists and hygienists, profitability. There's just like so many different layers of the onion that are beginning to be peeled back in this, and it's going to be really interesting to see how things shake out in the next couple of years.
Yeah, it's interesting you should say that, because that's what happened down here. When I put my hygienist on, we had no hygiene school in Sydney. But in Western Australia, there was only a hygiene school in Western Australia and in South Australia. So I went to Western Australia to interview, and a practice would have three hygienists. They'd have a full-time hygienist, they'd have a part-time hygienist, and then they'd have a casual. And if the full-time...
Sure. Fill in.
Yeah, they would just move patients from one hygienist to another and send the casual home.
Okay, yeah, got it.
So I went and interviewed, and I thought I'd done really well. I found a hygienist who wanted to come to Sydney. She had half her family lived in Sydney, and I even got her to meet. Or I was lucky that she met a Sydney man and married him. But then she went back to Western Australia. But she was so good in my office for 2 years. She was. Cast your mind back 25 years, Rachel. She was literally responsible for telling all my patients that they needed to have these old leaky amalgams replaced because they had cracks and nobody knew what was going on. And we systematically replaced all the amalgams with composites and inlays and onlays and crowns, and did those patients a great service in helping them keep those teeth rather than just popping off cusps every year. And so she was great, and we're still in touch today. Her children are now leaving school, and when we go to WA, we see her. She still comes over here sometimes. She's even been down to our farm.
Nice.
So that's the relationship that you want. But what I was interviewing one time, and I had two sisters who worked for me as dental assistants. They wanted to be hygienists, and they saw the marketplace change, because all of a sudden Sydney and Newcastle nearby had a hygiene school, and all of a sudden they saw 20 hygienists applying for one job, whereas before it was the other way around. And they said, why would I quit work, go and study for 2-3 years, and then the marketplace is saturated.
hmm
And so they actually
hmm
stayed
Make the
as
same
dental,
amount of money that you did as a dental assistant.
yeah,
Yeah.
they stayed as dental
Yeah.
assistants instead. And so,
Yeah.
again, they were just watching how the marketplace changed.
And it will change again. It will change again. This is where we are right now. So the supply and demand obviously created a significant increase in average hygiene wages, and in some regions of the country more than others, right? So some really urban areas, obviously, and high cost of living areas, it's gone up dramatically. I mean, I would say in some areas it's probably increased 30 to 40% over the last 5 years. So, and then what happens through that though is, business owners, in order to keep their business viable and to serve their customer, the business owners, regardless of the business, are going to find solutions to the problems that they have. So that's what's happening now. We're now seeing some of these solutions come into play with different legislation. So, for example, Arizona just passed some legislation that's allowing dental assistants to do above the gum scaling. They're going to have to go back for, I think it's 120 hours of education, and then they're going to be able to do above the gum line scaling. So there's a lot of different questions about, well, then are dentists going to hire assistants, but yet they can't diagnose periodontal disease? They're not going sub G. How is that going to affect? I think there are ways that those assistants can be incorporated into general practice to work alongside a hygienist, but it's creating a lot of uproar, obviously within the hygiene community. And it's a reflection that dental business owners, right, looked for. Okay, if we can't, some dental business owners are helping to expand dental hygiene schools in their areas. Some are helping to establish additional hygiene schools in their areas or satellite programs in their areas. And then some are putting forth legislation that they feel like is going to increase the availability of staff that can do these types of duties, right? Dental hygiene like duties. So that's one of the solutions that's coming up, and that's not the only state. And I expect that there will be other similar pieces of legislation in different states that will be passed as well. And so, these cycles of supply and demand, they, they come and they go, and things reset. So what will likely happen is, in certain areas, the hygiene wages will get reset back to maybe where they were. Or, the other hand is that hygienists can truly, really work and educate themselves to work at the top of their license, right? So if they're raising what assistants are able to do, then hygienists, we got to make sure that we're working at the very top of what we're able to do in our given state or given region, whatever our license applies. And certainly hygienists are also all looking continually to how can we elevate what our states allow us to do. But we've got to work on differentiating ourselves. If it appears that what we're doing is super gingival scaling, then there's not going to be much difference between the hygienist and the assistant. So we've got to make sure that we're communicating with patients, we're communicating with our employers, we're communicating with each other, and doing much more and really working at the top of our license in order to differentiate ourselves.
You've raised an interesting topic there, Rachel, because I've never heard of a cleaning or scaling separated into supragingival and subgingival.
I know.
Like,
I know.
what do they do? They section the calculus that's above
Yeah.
and then remove it, and leave subgingival. That, to me, isn't that neglect? I'm not allowed to remove subgingival, so I've got to leave it. So what's the point? Right, that's where the damage is done.
Right. So what's the point? So I would say that is the obvious. Kind of criticism of this method. Okay. I don't really understand the thinking behind this, other than I've really been racking my brains to think about, okay, how can we use this in our favor? How can this work in a positive manner? One way that it could work, and again, these are just thoughts, right, that I have been going through my mind the last week since this has kind of come about. And there are other states that have allowed this in the past. Illinois is another one. The other state, it might be Indiana. I'm not quite sure. Don't quote me on that. But perhaps in an assisted hygiene model, for example. So assisted hygiene, the way that we teach it is a hygienist and a dental assistant working together out of two columns. And the assistant doing the duties that that person is legally allowed to do, and the hygienist doing the duties that that person is legally allowed to do. So what if you had an assistant that was allowed to scale above the gum line, and they saw, they might be able to see children that haven't developed subgingival calculus at that point, and be able to coronal polish or disrupt the biofilm, that way. Perhaps you'd have patients that maybe they alternate. Maybe one time they see the assistant, and that assistant does the above gum line scaling, and the hygienist sees them on the alternate. That's not ideal, right? We need to be disrupting biofilm every time the patient comes in. But maybe there's I'm really stretching here to figure this out, David, but maybe there's a patient that we've established, with the dentist and the hygienist that's extremely healthy. Maybe they don't develop calculus, and so they could see the assistant on alternates. I don't know. I think maybe in some remote areas where there truly is a dental desert, perhaps there are ways that they can work with a dentist. And if the dentist identifies, hey, this patient doesn't have any subgingival calculus, but they need a polish, then the assistant can see them. I'm not sure the intended purpose of that. I'm trying to come up with, ways that can be incorporated to work well, but it's a bit of a stretch.
I think you've done a good job in terms of rationalising it for manpower and availability, and so that just didn't, because my practice was in a central business district. People didn't bring their children at all. We only really saw adults. So obviously, subgingival calculus doesn't really exist in children.
Not commonly. It does, but not very commonly. So that could be something that could take that patient load off of a hygienist. Here's the thing that I would say 40% of the dental practices that I talk to today about working with Inspired Hygiene and coaching, 40% of them, they can't get a scaling and root planing patient in their schedule in 4 months or more. And that's really unacceptable. Like what that does, David, is it creates a huge barrier for them to even diagnose.
Yes.
And nobody really wants to admit that, but that's what's happening, is that, the hygienist is doing the best that they can, and they see the patient, and they think, gosh, this patient really needs periodontal therapy, but I can't even get them in for 4 or 6 months. So I'm going to do the best I can today, and we'll check them the next time. And then that cycle keeps continuing because there's no resolution to this scheduling dilemma. And that's happening a lot. And so we're really trying to come up with creative ways to increase the capacity for care when there aren't hygienists available. Now, so that's happening, and it is becoming I think it's becoming a public health issue with access to care, even for patients that have an established relationship with dentists.
I agree. The schedule that we had in our office was that, the hygienist worked a 9-hour day, and 3 of her appointments would be new patient exams. 3 of her appointments would be 6-month regular hygiene, and 3 would be quarterly periodontal visits. And then my book was structured according to where those were with her. My endo was done when I wasn't needed to go in and see the perio patient.
Yep.
And it had to be like that. And so we we couldn't ignore periodontal disease because we had spaces in our book that needed to find it. And we knew it was there, as I think we spoke beforehand, about the percentage of over 50-year-olds who need to go 4 times a year just because periodontal disease is there. It's a genetic not genetic. It's the other one. It's an age-related periodontal disease as a result of.
Can be. Mm-hmm.
One of the things that I learned from I heard from another dentist, I didn't like it, was they were offering their patients, you need a deep cleaning. Like, what's a deep cleaning? Is that like
Mm-hmm.
your carpet cleaned deeper because your carpet is
Exactly.
dirtier? Like, you either it's periodontal disease or it's not. And if it's
Yes,
periodontal
that's right.
disease, then we need to do periodontal treatment. It's not an option.
That's
This is
exactly
what we
right.
need to do. And so, but
Yes.
they were offering it, and that people ringing up and saying, I don't want a deep cleaning today.
Right.
You want to lose your teeth.
I want a regular cleaning today. Yeah, that's one of the words that we put on the don't this we do a start saying, stop saying,
Yes.
right, when we're working on verbal skills, and the deep cleaning is the stop saying. And one reason why it's so confusing too is, patients that happen to have insurance, they feel like, oh, I get to go for my 2 free cleanings, and now you're going to bill me $850 for this deep cleaning, and I thought I was getting 2 free cleanings. We've not made the distinction that there's periodontal disease there. And so very often, we get the question of, how do I get patients to own the disease? Well, one, you can't own it for them, right? And a lot of times dental professionals will do that, and they'll do undercover periodontal therapy. They'll just do it anyway, right, in a prophy or a cleaning. And one is, you've got to make a distinction that something different is happening here, right? There's actually an active infection that requires this therapeutic, treatment. And if we're not giving the patients that education, they can't make those decisions for themselves. So, yeah, I'm very much with you. So, yeah, we're in a bit of a dilemma here right now, and it's not in every practice. There are plenty of practices, thankfully, that have a incredibly staffed hygiene department that is thriving and open and learning and growing, and adding new procedures and new products and new services all the time for patients. And it's incredible the amount of technology that is available, and new things that are coming out every month, right, in dentistry. And it's really our responsibility to pay attention to those things and bring that to our patients.
So tell me about that. You hinted at this before we started recording. What are the new things that are coming out now that are impacting on patients' periodontal health?
Yeah. So I would say in not even just periodontal, but overall. So some of these things you may have in Australia as well. I don't know the scope of the reach of all of these different techniques, but and I don't have. I'll let you know at the end if there's any of these that I have particular relationships with, but I'm not going to just product plug here, right? I'm just going to share a lot of different things. So several years ago, there is a global technology company called EMS. I'm sure you have EMS piezo units there in Australia, right? And they developed a new method for preventive and therapeutic hygiene care called guided biofilm therapy. So guided biofilm therapy is utilizing piezo technology along with subgingival air polishing to disrupt biofilm around natural teeth and implants. And it's really replacing kind of our traditional rotary polishing, right? Rubber cup polishing. And I would say it's still in the minority of dental practices here, but I think it is a trend that's going to continue. Hugh Freedy company has developed a new unit now also that has a piezo, and it has super and subgingival air polishing all in one unit. So it can be used in a similar manner. So I think that's something that is really, we've been teaching for 20 years that ultrasonics should be our primary scaling tool rather than hand instruments, and that we can accomplish 90 to 95% of what we need to accomplish with ultrasonics in a much more gentle way to the provider and to the patient. But that's finally kind of, picking up speed. And so that's something that's really exciting. I would say from a preventive standpoint, one of the things that's happening in the US here is water fluoridation. And so there are states that are removing water fluoridation. with the Making America Healthy Again initiatives. That's something that is in question. So there are some non-fluoride hydroxyapatite caries prevention products that are really taking off. There are probiotics, prebiotics, postbiotics that are changing the oral microbiome to help repopulate, right, the subgingival biome with healthy bacteria and keeping some of the bad bacteria at bay, and also helping reduce risk for caries. All of the AI technology with radiographic, interpretation, that's just fantastic and continues to grow. A lot of voice. I mean, we've had voice charting with Florida Probe, which is a company that we work with quite a bit for many, many years. And that's becoming more commonplace with the voice clinical notes and things like that too. So there's just so much, lots of different disinfectants to use with periodontal therapy that are relatively new. Another product that we have done some work with is by a company called Vivardis. The product is called Curodont, and it is a peptide that can go into just incipient lesions and build a matrix and pull in hydroxyapatite from the saliva and rebuild enamel in early incipient lesions. So there's just some really amazing things that are happening. And so what I'm urging hygienists to do, right, and a lot of those things is, requires the dentist, the dental clinical leader, right, is typically the dentist in the practice. It requires them to be open to those things, right? In order for the hygienist to utilize some of these products, it has to have the blessing from the dentist first, typically. So I'm just really urging practices like, look at this, like break out of that just scale and polish, and the prophy trap, and look at these things that really are making a difference for patients and can enable us to really differentiate ourselves, our practices, and also, help patients have better outcomes.
Ultimately, that's what it is, Rachel. And I think you've just touched on it, and we can talk about this. It is the oral systemic link now, that the mouth is not separate
Yes,
to the body, and the body's not separate to
absolutely.
the mouth, and the mouth isn't. It's not even just a window to the body. The mouth
Yep.
affects the body as well.
Yes.
The discussions that I've heard about the toxins from P. gingivalis, if they get in the blood, they can cross the blood-brain barrier and lead to
Absolutely.
early onset Alzheimer's,
Mm-hmm.
diabetes, a whole pile
Mm-hmm.
of things.
Mm-hmm. Yeah, absolutely. And so that is something that I still believe is not fully um, integrated into the communication of dental professionals to patients. I mean, again, we've been preaching this for 20 years, and the body of evidence just continues to build and build. So I just read an article that's in the Journal of American Dental Association, and it was an editorial on, this Make America Healthy Again campaign. And one of the quotes in it was, I won't get this exactly right, but it was basically, we have the opportunity to reconnect the mouth to the rest of the body.
Mm.
So if we're looking at health right now, there's a huge missing link, right, in the medical community in America with dentistry. There are some select, very progressive thinking physicians that are saying, hey, when were you at your dentist last? You have diabetes and rheumatoid arthritis and sleep apnea and all these other things. Like, you better make sure that your oral health is in check, because it's going to increase your risk for all these other things. That's few and far between that those conversations are happening in the medical community. So I think we have the opportunity, if we as Americans are really beginning to look critically at the things that are affecting our overall health, then we need to raise our hands as dental professionals and be a huge part of that conversation.
Yeah, I guess it's how committed are each person in the population at wanting to live longer and do the things that impact on their life expectancy, and
And
consider
but
the mouth as
even
part of the body.
and even not even just living longer, but living better while we are
Mm,
alive.
mm,
Like, and reducing the incidence of these chronic diseases that really impact, individuals' ability to enjoy their life. So yes, longevity, and there's also the term uh, lifespan, but also health span. I didn't create that, right? But having a really long health span where the majority of our life is lived in a very healthy way, both, physically, cognitively, all of our different abilities to move around and enjoy ourselves and be with the people that we love.
Tell me, one of the things, and I'm guilty of this, is that while I employed a hygienist, they work on their own without assistance. But now in coaching, I encourage all my clients that on an occupational health and safety matter, they need to have a hygienist with an assistant, because they can't
Mm-hmm.
operate a suction, a, a scaler, and a mirror.
Mm-hmm.
They can't hold all three at the
Mm-hmm.
same time. So they're going to bend their backs, and you're talking to somebody who had to work left-handed in a right-handed world for
Oh
3 or
gosh,
4 years
yeah.
before I got my own office. And that, I think that was part of my success, was that I realized that I had to maximize my time as a left-hander before I then set up a room for a right-hander to come and work for me.
Yeah. Yeah.
So,
Yeah.
occupational health and safety is important for the spines and the necks of our
Yeah.
hygienists.
Yeah. We've been doing that for a very, very long time, right? Four-handed dentistry with two hands. So it's not common here that I will tell you, when there is a hygiene assistant, the two models that I see when they're incorporated is when there are I would say 4 or more hygienists in a practice, and um, and they're helping them turn over their rooms, and they're helping with reappointing patients and that kind of thing, kind of helping the hygiene department move along. The other model I will say is when they're working in a similar model to the dentist, right? Where they're working possibly out of 2 rooms. They're kind of going from one room to the next, right? And the assistant is doing some of the procedures that they can do on their own while the hygienist is doing things in their operatory. Certainly, I would say, it's fantastic if especially if there's a difficult periodontal patient, with lots of bleeding and debris and things like that, where the high-speed suction is necessary, with a high volume evacuator tip. Certainly that's fantastic when there can be an assistant. It's not that common. It's just not that common. And I would say that usually the reason for that is the financial, right? Just looking at that. And I would say as the hygiene wages in the US have gone up dramatically, insurance reimbursement has gone down. And expenses have gone up, just general supply expenses and things like that have gone up. And so, the likelihood of, that having that assistant there needs to be, at least in the current view, ideally a way for that assistant to help generate additional revenue in the hygiene department to offset that, compensation there. So that's another piece that's really creating a pinch point within dental practices in our industry as a whole, is just that the inverse relationship, right, between hygiene wages and hygiene production coming into the practice. Now, in a fee-for-service practice where the patients are paying, the full fee, and their insurance might contribute some, or they may not have insurance at all, it's less of a challenge because, but it's still, in some instances, it can be, because, if a hygienist is making $100 an hour, are you going to price yourself out of being competitive if you're charging $300 per hour for a routine, hygiene visit? So yeah, this is kind of where we are right now.
Well, I guess it comes down to, Rachel, it's the same with hotel beds. Once you're asleep, how much are you paying for a bed?
Does it
Or are you
matter?
paying for the
Right.
experience or the comfort?
Yeah.
And I think if there's value, people see it. Now,
Yeah.
I,
We've got to bring the value, though. We've got to differentiate that.
I'm a retired dentist, but I actually go to 2 different practices, because
Okay.
what happened was that my regular dentist he had a pandemic in his practice, in that every hygienist he hired got pregnant. So he had no hygienist. They'd ring and they say, your
Mm-hmm.
appointment's next week. Guess what? We haven't got a hygienist, so it'll be in 6 months'
Mm.
time. So then I found another
Mm-hmm.
practice where an ex-employee of mine was working as a hygienist 2 days a week.
Okay.
So I started going to her on months 3 and 9, and back to my other one on months 6 and 12. And I think
Wow.
one knew about the other. It's kind of like, you know, having a girlfriend on the
You're not
side.
cheating on one or the
Yeah,
other.
yeah, one of them knew. But now that they're both back, it's kind of it's weird. But again, because of my age, I just find that I want to have my teeth cleaned 4 times a year, not twice a year, and I enjoy that level of service. And I'm paying out of pocket.
Mm-hmm.
I've got no insurance,
Right. Right.
but
Right.
it's just something that I choose to do. And hopefully, whoever's watching this will say, "Well, gosh, if he's a dentist and he's got a dental education and he's going 4 times a year, then maybe I should too, if I'm in that age category, if I want to keep my teeth as long as possible." Now, one of my patients died at the age of 97 with all his teeth, and he was a
Wow. That's
Second
amazing.
World War prisoner,
Wow.
and he had all his teeth
Wow.
fully restored. He had all his. In fact, he died after I retired. I inherited him from the practice that I'd bought, and he followed me when I left my office. He followed me to another office where I worked for a friend, and the dentist who my friend called me after I'd retired, and he said, John's passed away at 97, and he was still playing tennis.
Mm.
He's still having tennis lessons, like you talked about living healthy. He was still having
Yeah.
tennis lessons in his 90s.
Yeah. Yeah. Right. Like, don't we all wish for that? I mean, that's the ideal, right? You're playing tennis one day and the next you're on to your next life. Like that's what we would all hope for at 97. So, but you're in a very, very, very small minority, David, that's willing to do that, right? Much of what's happening when, the hygienist is, not available and you have to book the patient out, patients just wait. They wait or they go find another dentist. Like some of them will do that, but most of them won't go to two, right? They'll just move all of their family over. So yeah, it's a dilemma, I would say, for sure. Just really resetting the supply of dental hygiene providers, and also I think there's a lot of moving and shaking here with dental hygiene to expand the role of the dental hygienist and allow them to have more autonomy, and that is very state specific, um, and very different in many states there, but just it's going to be very interesting to see how things evolve over the next few years. I think there are some new dental hygiene schools that are opening. You brought up a point, um, about your dental assistants, deciding, once the market got saturated, they didn't want to become a hygienist. That I saw that absolutely happen probably 10 years ago. It was happening in Florida. I had hygienists that would reach out to me and say, I can't find a position, or this is what they're paying. And it was very much below the national average. And then I worked with a practice in Canada many years ago, and that was happening there too. And a lot of what had happened was a lot of private proprietary dental hygiene schools had come in, and right, they can open up, and it's not like a state run community college that's really looking at the demographics and the demand for serving the citizens of that state. A private dental program is coming in and saying, hey, can we do some marketing? Is there a shortage in this area? And can we get as many dental hygiene students in as we can? I'm not saying all those schools are bad, but it's a different model. And they're not necessarily looking at the long-term impact on, the job market. And so there were hygienists working as dental assistants in these practices in Canada, just waiting for somebody to leave for whatever reason so that they could step into that hygiene role. And there was not a huge difference in pay. There was a slight increase, but it wasn't a significant difference because they didn't, there wasn't there wasn't the it's that supply and demand again.
It's interesting that you have private hygiene schools. You don't have private dental schools, though, set up, do you? Aren't they all related to
Yes.
universities?
Yes, there are some private dental schools now. Um, yes, and I would say that they are, and again, I'm not an expert on this, so may be corrected, but um, they are private professional schools. So, like, they might have chiropractics there, that kind of thing, and they're very, very expensive. But yes, yes. In fact, in North Carolina, there is a school, there's a private university, a very unique private university, and Heartland, a huge DSO, corporate DSO here in the US, they have invested in that school and they are building a dental school. It will be open in the next couple of years, I would think, at this private university. Yeah.
Is that Nido Cobain? Is that his?
Yes,
There you
yes,
go. Yeah.
yep,
Yeah,
yes. That is his school. That is his university,
yep.
and so they have partnered with Heartland, and they've invested in building a dental school there, and that's in North Carolina. Yep, and that'll be open. And I believe that they also have plans for a dental hygiene school. I don't know that that's there, but I'm pretty sure. And honestly, wouldn't that make sense for a large, dental corporation like that to
Mm.
be able to train hygienists and professionals to come into their, dental practices?
Yeah, and it also builds a relationship with the student that they feel obliged to stay on with the provider of the education as an employee for longer, as opposed to
Well,
you have an independent education, then you go out into the workforce
yes.
in general.
I would expect that Heartland is the curriculum that they're developing is going to give these dentists a much more thorough business education that they don't typically get in dental school.
I would hope so, but I don't know whether they are giving them a business education or they're just giving them a DSO education.
Mm, yeah, good point.
If they train them to work in for them, then they may not need to educate them in some of the things that the general dentists need to be educated in, which they aren't getting at university anyway. The HR, the marketing, the
Yeah.
business ownership stuff.
And you make a really good point. And I would say at the very least, I would hope that they're training them on leadership, right? Leading yourself, leading others, um, proactive, um, proactive treatment planning and just really giving them that thorough education there. But it, all remains to be seen, but it's interesting developments.
So I just want to tidy up one little thing there. I don't know whether this has happened in the United States, but when I went to university, I went straight from school to a 5-year degree and then became a dentist. But they
Mm-hmm.
changed the qualification for dentistry sometime in the 2000s. That dentistry was a secondary science degree, so they could go from school to do a science-based course of any nature and then apply for dentistry. So what was happening was that
Yes.
people with no interest in dentistry or in dental hygiene were becoming dental hygienists. That was their science-based degree, and then piggybacking into dentistry as a result of that.
Yes.
So hygiene was actually a transit lounge for dentistry.
Mm-hmm. A stepping
Whereas,
stone. Mm-hmm.
yeah, maybe
Mm-hmm.
stepping stone's more polite than transit lounge. But so we were getting temporary hygienists who were temporary.
Mm-hmm.
It was their temporary career because they
Mm-hmm.
all wanted to be
Mm-hmm.
a dentist, or a
Yes.
majority did. And so, whereas when I was hiring hygienists, they were career hygienists, and
Yeah.
you're a career hygienist,
Yeah.
but now finding career hygienists is difficult.
I would say that the vast majority of dental hygienists in the US are career hygienists. Uh, there certainly are hygienists that that go to dental hygiene school as that stepping stone. And there are some that go into dental hygiene and then they recognize that they want to become a dentist. But my guess is that that is a small percentage. So they typically are going into dental hygiene intending for that to be a career. Now, whether it is a full-time career, that's another thing. So the other thing that happened after the pandemic was when dental hygienists came back to work, there were fewer of them that were working full-time. So while there could be a similar number of licensed hygienists, right, without doing a vast survey of the number of hours that are being worked. I mean, there are some surveys that are out there, but they're not huge. We have, all the states can report the number of licensed hygienists, but how many hours are those hygienists working? And so I think the staffing challenge has come from, yes, people leaving the industry. There was a bit of a gap there just from the educational standpoint and hygienists entering the profession. And then also there's been a change in the number of days. There are more hygienists that are working fewer days. They can make more per hour, right? So they can often afford to work fewer days. There are also a lot more opportunities for hygienists in non-clinical positions now. There are when I graduated from dental hygiene school 30 plus years ago, you either became an educator or you worked in a dental practice. That was about it. There are a lot of different opportunities now for dental hygienists. So they may still be licensed, but they may not be working chairside. So all of those things do contribute to, difficulty in staffing and being able to really have the amount of hygiene hours that you need to serve patients.
Now, really good question. I think it's going to be a good question for you because it talks about the management of dental offices in general, and you've just touched on it. One of the difficulties I find as a coach, and I find talking to dentists, is dental offices are open more than 4 days a week, and they have employees who work less than 4 days a week. So they've got job shares in dentists, job shares in dental hygiene, job shares in reception, job shares in dental assisting. And I find that the less staff that you have, which means the more long-term permanent, long employed, multi-day, is much easier than having to say the same thing over 6 times a week or 4 times a week for 4 people doing the same job on different days. Are you finding that in hygiene? And clients that you're dealing with in terms of, one hygienist has a style, another hygienist has another style, dentists have styles. All of a sudden,
the patients, there's no continuity of care between the providers.
Jane just sold one of her master classes, an online thing for answering phones, and she onboards this practice. They have 7 chairs. They have no hygienists. They have 7 different dentists there. And the first thing Jane said is, "What's your standard phone greeting?" No standard phone greeting. I said, "Jane, you've discovered the 7 dwarfs of dentistry. They've got 7 different types of people working in 7 different offices. Grumpy, sneezy, all of them." So where's the consistency? So how do you coach in that sort of environment if that's the trend to less full-time commitment?
And I would say that has been very common in dental hygiene for many, many years because it is still primarily a female, still the number of hygienists that are female is much greater than male. And it's just a matter of fact that, let's say, more females are mothers than men, right? I mean, I know that sounds like a dumb statement, but it's just kind of that thing, right? You're going to have hygienists that are, because it's a highly female career base, you're going to have more people that are taking off maternity leave that are deciding to work fewer days in their job sharing. So it's been very common here for a very long time, and even more so now. And then the other thing that you throw in there is there's more hygienists now that are temping. So they're temping as their primary way of working as a hygienist. Like that's what they do now. They're career fill-in hygienists because they can work when they want and they can make a greater wage. Now there's a pros and cons to all of that, but it does present a very challenging situation. But I will tell you, That is one of the primary reasons why dentists call Inspired Hygiene, is because we are able to help calibrate all of those hygienists. And it really does, it is a combination of virtual education, kind of leveling the playing field of here are the standards of care based on the American Academy of Periodontology and, clinical standards that are taught in dental schools. So giving everybody that level playing field of clinical standards, we educate them on the oral systemic link, on, coding and verbal skills and all of that virtually, so they can all watch that, together or wherever they happen to be. And then we pre-schedule so that all the hygienists that are working, regardless of how many days, they all come to the practice on 2 days that our coaches are there. And we do clinical calibration. Is everybody even reading the probe the same? And when they're reading the probe the same and collecting all of this diagnostic data, then we need to be having the same output from a diagnosis. So we calibrate diagnosis, we calibrate radiograph interpretation, periodontal, screenings, and then we help the team establish their own standard of care. So this practice didn't have a standard way of answering the phone. They probably don't have a standard way of diagnosing and treatment planning either.
They didn't have a standard way of setting up trays even. It was
right.
But
it's chaos.
I tend to find that is the majority of dental offices.
Yes.
There is no system.
Yes.
Yet you can't go and work at the Four Seasons if you've been working at Motel 99 and use the Motel 99 systems. You've got to work under the Four Seasons code of conduct and
framework. That's right.
Exactly. But in dentistry, it's kind of like, well, there's your room, off you go. And so we have inconsistency.
And I kind of came to this realization. I was explaining, I have these friends that I've known forever, and they're like, so tell us again what you do. They don't really understand it. I said, okay, one of them is a nurse anesthetist, and one of them is a mammographer. Okay, so they both have and they work for big hospitals, right? So there are governance, rules of governance and standards of care that they must abide by. There's no one in the U.S. really, unless the body that is the regulatory body that it's overseeing clinical standards of dental practices right now is insurance, dental insurance. And then if a doctor gets reported, there's a complaint to the board or there's a lawsuit. That's really the only time that there's any evaluation by anybody, other than the dentist, him or herself, in their own practice. No one else is really looking at their standards of care. And I was just talking to a dentist recently, actually was an office manager recently, and they have a big rift in their hygiene department. It's like 3 hygienists against 2. And really what I determined in just a short conversation was it likely all comes down to the fact that there's no standard of care. And so one of them thinks that the others are overdiagnosing, and then they think the other group is underdiagnosing. And then the patients are caught in the middle, and there's no continuity of care. So one patient could see the other one and they're like, oh my gosh, they didn't even diagnose this. And now I'm going to tell them, and what are they going to think about this other hygienist? If they would just sit down and create a standard of care, it would solve a lot of problems.
I think it's not just hygiene, it comes from the top.
Absolutely, 100. And that's what I said. This is a leadership problem.
Yeah, the fish stinks from the head down.
That's right.
And so if there's no leadership, it's just a mess. And if McDonald's can do it, if Chick-fil-A can do it, roll it out, nationwide where it's consistency. Why can't a dental office do it in just one location?
Yeah.
And it
can be done.
Leadership. Rachel, we're running close to the end of time. Now, you did mention before we started that you had, and this is a whole other subject, an oral cancer screening protocol document that you could share. Let's talk about oral cancer, because that is a new wave of dentistry that has been ignored in the past, but now
Hmm.
there's there's a vaccine for the adolescents, so
Yes.
they don't get it.
Yeah, for
So,
HPV.
yeah, for
Hmm.
HPV.
Hmm.
So
Hmm.
talk us quickly through the oral cancer screening and why it's so important.
Yeah, so it's actually a fairly frequently neglected part of the hygiene exam. Now, most hygienists, I would say, do an intraoral screening of sorts. Not that many do a head and neck screening, right? Extraoral head and neck screening. And certainly there's a lot that can be detected in a screening that needs to be investigated for that. And you and I were talking in the pre-show is I've heard team members say, I don't want to do that because what if I miss something and then I get sued? Okay, well, if you don't do a screening, you're for sure going to miss something. So our job as dental professionals or they'll say, I'm a hygienist, I'm not supposed to diagnose oral cancer. 100% correct. The point is not to make a diagnosis. The point is to screen and determine if there's something that needs to get to the right provider, and that individual can make the diagnosis. So April is actually Oral Cancer Awareness Month in the U.S. I don't know if that's a global thing. Is that true there too? Okay.
It's not down
So
here, but I am aware that it is in the US.
yes, yeah. So what we do, we created an oral cancer screening guide. It is free on our website. So I'll send you the link. You can put it in the show notes. But folks can go to inspiredhygiene.com. There's a tab that says resource guide and just look at the drop down. There's a ton of different free resources there. You can grab those. And really it helps a team really kind of come together and calibrate on what are we going to be delivering? How frequently are we going to be doing this for our patients? And let's all learn and get on the same page. So there's a link on there to a video of how to do an extra oral cancer screening. And then there's also some pointers on, okay, if you do discover something that's suspicious, what is the system, right? Like you just said, let's set a system so we're all doing it the same way of how are we referring, how are we following up on those referrals, and really doing everything in our power to make sure our patients are getting the care that we need. So yeah, happy to share that.
All right, excellent. Rachel, is your website the best way for people to get in touch with you? Or is
Yeah,
there a better
absolutely.
way?
So, yep. And on our website, there's a link there if you want to book a discovery meeting just to kind of learn about our services and how we can help. Always happy to do that and happy to chat.
And I think I reconnected with you via LinkedIn. So
Yeah, I'm on LinkedIn as well.
there we go. So easy. I'll put those in the show notes as well.
Perfect. Thank you.
Rachel, I said before we started recording that we could probably talk for a day, and we've run out of time, and we could have. It's been so good to have you. Thanks very much for being a guest on the Ultimate Dental Podcast. Really appreciate your time.
Thank you, David. My pleasure.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.